people know what depression is. Almost everyone suffers from occasional depression with symptoms like sadness, pessimism, and low energy. It is only when depression lasts 2 weeks or more that it becomes a clinical disorder, at which point it is called major depression. It is important to understand that when someone has depression, there are actual physical changes in the structure of the brain, as well as reduced levels of important chemicals called neurotransmitters. Neurotransmitters are chemical messengers that allow communication between nerves, but they're also important for mood regulation. People suffering from depression typically have reduced levels of neurotransmitters, especially serotonin. Lower levels of serotonin lead to mood destabilization and depression. People suffering from depression can also have related changes in their brain structure. For example, people with a history of depression have a smaller hippocampus than others. This is significant because the hippocampus is an important serotonin receptor.
Depression is one of the most common psychiatric disorders. Symptoms of depression are often subtle and unrecognized by both patients and physicians. The brain contains a network of interconnected nerve cells called neurons. The junction between the neurons is called the synaptic junction. The transmission of impulses from one neuron to another is facilitated by chemicals called neurotransmitters. The impulse triggers the release of neurotransmitters from one neuron, which cross the synaptic junction and attach themselves to the receptors in the adjacent neuron, sending the message through. Later, the neurotransmitter returns to the initial neuron via the reuptake channel. One of the causes of depression is believed to be the depletion of the amine neurotransmitters serotonin and norepinephrine. Antidepressant drugs increase the availability of neurotransmitters at the synaptic junction by blocking the reuptake channel.
Although people commonly think of depression as a single illness, there are actually several different types with different causes and treatments. One common type of depression is major depression. Symptoms often include overwhelming feelings of sadness, also low energy, and feelings of worthlessness. Another kind of depression, dysthymia, is a prolonged chronic condition with less severe symptoms than those of major depression. Although milder in nature, dysthymia does tend to last 2 years or longer. Adjustment disorder can occur in the aftermath of a sad or life-transitional event, like death of a loved one or the loss of a job. A period of unhappiness is normal, but if the depressed feelings continue for several months, then a diagnosis of adjustment disorder may be appropriate. One other common kind of depression is seasonal affective disorder, a pattern of depression related to a lack of exposure to sunlight. Typically, SAD sufferers notice symptoms during winter when days are shortest. However, they can often be helped with a light box that replaces lost sunlight. Good treatments exist for most kinds of depression, but self-diagnosis is tricky. If you think you're suffering from depression, the first step towards feeling better is to see a doctor.
Want to learn more? Check out other videos and sources on this site for more information.